Welcome. Today we'll be presenting improving health outcomes by limiting urban air pollution. It's not air pollution that kills people, but people are dying sooner than they would otherwise. Roberto Cruz of Mexico City. As air quality continues to worsen around the globe, more and more citizens continue to suffer. In this presentation, we will work to demystify this phenomenon and provide a potential solution. In the conversation surrounding air quality, air pollution is the leading culprit of adverse health conditions. Of the many substances that make up air pollution, here we discuss the 5 leading factors as identified by the U.S. Environmental Protection Agency, the most damaging being particulate matter or PM. We also have hydrocarbon, nitrogen oxide, carbon monoxide, and sulfur dioxide, which all are reactions to the heating, burning, and stimulating of dangerous gases, often found in diesel-based fuels. Focusing again on particulate matter, it's important to note that these dangerous particles come in 2 distinct size ranges measured in micrometers, one being PM10, the larger of the two, which can most often be found in diesel exhaust and is a tenth of a human hair. The smaller and more dangerous, PM2.5, is not as detectable and can easily penetrate the respiratory system where it accumulates.
There are 2 types of air pollution, indoor, coming from household, and then outdoor air pollution. Although there are more people who die from indoor pollution annually than outdoor pollution, our project will be focusing on air pollution-induced deaths or health risks coming from the outdoor ambient air pollution. So roughly there is about 4.3 million people who die annually from household air pollution, most of them in Asia, and this is caused by the use of solid fuels for heating, such as coal, wood, and charcoal. Outdoor pollution, those most at risk are the residents in urban settings, mega cities such as Beijing, Delhi in India, and Lagos, Nigeria in Africa, for instance.
We've listed here some of the main causes of air pollution. Along with road construction, factories, and waste incinerators, automobiles is one of the leading causes of pollution. And this will be the main focus on which we continue through our presentation.
Since our project focuses on air pollution coming from vehicular or mobile sources, we wanted to zoom in on 2 cities and give you some facts and figures on emissions of PM as well as some toxic chemicals coming from vehicles. So just looking at Beijing on PM 2.5, about over 30% of the emissions come from vehicles. And in London, PM 10 level, for instance, a whopping 66% comes from vehicles, and often this comes from vehicles using diesel fuels. In terms of the carbon monoxide emissions, for instance, 85 to 90% of the emissions come from vehicle sources in both cities, and in nitrogen oxides, for instance, somewhere between 50 to 63% of the emissions come from vehicles. Almost a similar level of emissions also come from vehicles in terms of the hydrocarbons. Just to give you a purview of the global levels of air quality, we made use of the World Air Quality Index project, which is a social enterprise project that was started in 2007, based in China, that looks at the levels of air quality across the globe in specific countries and cities. And it makes use of the APA standard to flag areas by differing air quality standards. And as you can see on the map, China, most of the countries within the Southeast Asia subcontinent have high as well as hazardous levels of air pollution. Apart from these megacities that are already suffering from hazardous or very unhealthy levels of air pollution, you can see that some cities that are not large in terms of population size also suffer from high levels of bad air quality. And this has to do particularly with the levels of indoor air pollution, because most of these cities happen to be in mountainous areas that require the use of fossil fuels for heating, and this contributes to large levels of soot and particulate matter that contribute to high levels of bad air quality.
As my colleague pointed out, global air pollution tends to be concentrated in major urban areas. Unfortunately, thanks to urbanization, more than half of the world's population, 3.7 billion, now lives in a city. And the amount of major cities will only continue to grow, which can lead to further health complications. Business Insider predicts that as cities grow, the number of cars will increase, and the World Bank believes that this will lead to higher concentrated pockets of air pollution at the street level.
Air pollution should be considered a major public health problem. This requires urgent, determined, and multidisciplinary action that is long overdue. Indeed, if we do not act now, our children and generations to follow will be those who suffer from our failure to act. Serious health risks are associated with air pollution, ranging from more mild conditions like irritated eyes and throats to more serious ones like asthma and cardiovascular conditions that can result in death. The World Health Organization measures that a significant number of disability-adjusted life years are lost to air pollution, with 51 million DALYs lost because of lower respiratory tract infection, 26 million DALYs lost because of neonatal conditions, and 11 million lost because of asthma. These numbers are concerning. We saw that in New York City, there were significant air pollution effects in the Bronx, including significantly high rates of asthma. We also noticed that this related to a global issue of urbanization and increasing rates of air pollution. We think that we've found a solution that addresses both the global and the local issue.
Our investigation focused on the Bronx, with alarmingly high rates of asthma prevalence in the city. And so we went to visit two specific neighborhoods within the Bronx. One was Hunts Point, and the other one is Port Morris neighborhood. In Hunts Point neighborhood, for instance, the asthma rate is twice the New York City average. And as you can see in the graphics, most residents are on Medicaid and Child Health Plan. But interestingly, in terms of insurance coverage, they fall below the New York City average. Hunts Point is the location of one of the largest food distribution facilities in the world, which is the Hunts Point Cooperative Market. And Hunts Point serves as a major distribution center for a number of independent wholesale distribution that service roughly 22 million people around the New York City metro area. So given this fact, there are about 20,000 trucks that come in and out of this neighborhood every week. But this is just accounting for the trucks that ferry in food supplies in and out of the neighborhood. When you factor in other trucks that pass by, the interstates that intersect this neighborhood, the number of traffic is a lot higher than the number in other neighborhoods in New York City.
If you had to say out of 10, how many people do you think have asthma?
It's 7 out of 10, yeah.
7 out of 10 would have asthma? Wow.
I think it's the environment.
Yeah? What about the environment do you think it is?
Probably all the trucks and stuff that come through here.
Uh-huh.
All the exhaust coming from their cars and all that.
During our trip to the Bronx, we interviewed almost a dozen people, nearly all of whom identified auto exhaust as a major cause of asthma in their communities. Additionally, people mentioned indoor sources of pollution such as pests, smoke, and poor infrastructure, including poor heating conditions in their buildings. Currently, there are a number of laws in place to address these issues, one of which is an idling law which prohibits trucks from idling for more than 3 minutes. One of the facilities that we visited in the Bronx had the following sign pictured. However, when we spoke to a security guard there, he told us that trucks at that plant were allowed to idle for approximately 10 minutes, and that there weren't very frequent checks on the amount of time that people could idle. So what we realized is there's a lot of inconsistencies in these laws, and it's probably preventing the air pollution from drastically improving. We also noticed that there's a lack of coordination between businesses, so the volume that the trucks are actually carrying isn't fully maximized. We also noticed that there were no green trucks in the Bronx. So there's a green truck incentivization program here in New York. However, because it's an incentive program, it's not extremely effective.
Zooming out, we see again that air pollution is not only an issue in the Bronx, but a global issue impacting major cities like Delhi, where 40% of all air pollution comes from vehicles and 60% of that from trucks. Or places like Mexico City, where the number of cars has spiked from 4 million to 6.8 million in 10 years. And London, where 36% of all vehicles are now diesel. which is up from the previous marker of 7%, or even places like Beijing, where 5.5 million vehicles account for nearly 30% of the city's air pollution emissions. So in analyzing existing issues and proposed solutions around the globe, we compiled a list of potential interventions which include the taxing of new car purchases, car-free days, and methods of incentivizing mass transit. However, due to the immense amount of emissions, frequency in use, and the burning of dirty fuel from freight vehicles, all for the similar pursuit of completing delivery, we see an immense amount of potential here for consolidation.
So here's the problem. Increasing urbanization leads to higher population densities. This leads to a large number and wide variety of businesses with delivery demands and a large number of delivering and shipping companies with no coordination between these companies. There's a high number of local deliveries and low load factor per delivery, which leads to a high volume of trucks in urban areas, increased traffic and slower delivery times, and all of that leads to high level of diesel emissions. Urbanization is not a new issue, and there is a long history of public policy designed around solving the issues of congestion that come from high urbanization rates. In ancient Rome, for example, all carts and carriages were banned from entering the city during the day. They could only enter the city at night.
The modern urban logistics ecosystem needs to account for economic, environmental, political, and regulatory factors, and take into account technological and consumer trends. This ecosystem needs to be able to manage the public and private sector interests between transporters, retailers, and public authorities. By taking into account the boundary conditions, the facilitators, and the stakeholders, a centralized conduit needs to be installed. This is where the Urban Distribution Center, or UDC, comes into play. As defined by the New York City Department of Transportation, an urban distribution center is a facility involving the transshipment of goods directed to urban areas, aiming to consolidate deliveries and thus provide greater efficiency in the distribution process by increasing the truckload factor and decreasing the number of trucks used, which help mitigate urban congestion and air pollution.
An urban distribution center acts as a consolidation point for all deliveries entering the city. There, deliveries can be coordinated and sorted for most efficient delivery, where specific urban transport vehicles then deliver goods by the quickest route at the most appropriate times. A great example of an urban distribution center is Monaco Logistique. Monaco Logistique was created through a public-private partnership in 1998 and now contains 4 urban distribution centers totaling more than 30,000 square meters of space and contains a single fleet of delivery vehicles that is responsible for all citywide deliveries.
Distribution centers act as a point of consolidation for all goods coming into the city. This allows flexibility for both retailers and direct customers to either choose to pick up deliveries themselves or utilize city-bound deliveries made to them using shuttles. The aforementioned shuttles in the Monaco model operate as a single fleet. This allows for both consolidation and cooperation on the delivery side. It also acts to reduce the number of delivery vehicles on the roads, impacting both congestion and emissions. While the Monaco model does not currently use green vehicles, there is a clear opportunity for a green vehicle mandate to be introduced. This may be in the form of low emission standards for delivery vehicles, or for the entire single fleet to be electric vehicles. One of the major advantages of the Monaco model is its economies of scale. Specifically, there is an increase in the load factor of vehicles measured by delivery weight per trip. There is also a reduction in the number of trips, an increase in nighttime deliveries, and an overall reduction in fuel, or in the case of electric vehicles, energy use. Another advantage of the Monaco model is its seamless integration with existing systems put in place by the Department of Transportation. This allows for increased coordinated route planning for nighttime deliveries, a reduction in overall mileage and vehicle miles traveled, and a reduction in the average distance between deliveries.
The benefits of the Monaco PPP model all stem from a single company management, which allows for a compulsory usage of urban consolidation centers, which leads to fewer trucks and less congestion. A single fleet of urban transport vehicles, which leads to lower emissions and pollution, economies of scale and greater efficiency, which leads to lower costs per delivery, and seamless integration with traffic monitoring system, which leads to quicker deliveries and less congestion. Our policy recommendation to reduce air pollution in the Bronx, which leads to high asthma rates and other pulmonary issues, is to create a public-private partnership very similar to the Monaco model. This would create an urban distribution center in the Hunts Point neighborhood. It would involve an open bid for the management of citywide logistics, would require a single fleet of low-emissions vehicles for all urban deliveries, and would cooperate with the New York City Transportation Department for the use of intelligent transport systems like vehicle tracking and traffic monitoring. The great thing about public-private partnerships is that they can be replicated in many different contexts. There's a lot of room for flexibility in the arrangement and structure of the actual partnership. The urban distribution center can be compulsory or it can be merely encouraged, and there doesn't necessarily need to be a single fleet of vehicles managing all urban deliveries. There are already many different models being experimented with in Europe, Japan, and China, all of which provide some level of consolidation which limits urban trucking and diesel pollution. As was mentioned before, 96% of the urbanization that happens between now and 2030 will happen in the developing countries. This means that the pressures that we are experiencing now in the developing world due to high population densities in the cities will be the same in the developing countries in the coming years. This means that urban distribution centers will be a growing concern for these countries. Public-private partnerships allow for flexibility in the implementation of these distribution centers based on local contexts.
The Monaco model shows a clear reduction in local atmospheric pollution in terms of carbon dioxide, carbon monoxide, sulfur dioxide, and various nitrous oxides. It also shows a reduction in traffic congestion and fuel consumption. These results are mirrored in the City of London, both in the heart of the city and at a major airport, where atmospheric pollution, traffic, fuel consumption, and journey time have been reported as reduced. As shown in the cases reviewed, an urban distribution center has the capacity to alleviate city congestion and reduce emissions, both through decreasing travel time and decreasing fuel consumption. This leads to a reduction in particulate matter and improves air quality. This leads us back to why the intervention was necessary in the first place. Improved air quality in the city leads to reduced severity of conditions conducive to respiratory diseases, including asthma. The health benefits of an urban distribution center are clear to be seen. Let us now review the incentives of the urban distribution center intervention at Hunts Point in the Bronx. For the government, dealing with public roads and air as a public good, reduction in congestion, emissions, and air pollution are the significant benefits. They impact social, environmental, and especially health concerns through the reduction in air pollution and therefore reduction in conditions that would cause respiratory diseases, including asthma. This would have an alleviating effect on Asthma Alley and surrounding areas in the Bronx. For retailers, improved delivery speeds and reduced costs provide a direct benefit for their involvement in such an intervention. Transporters as well will experience improved efficiency, optimized scheduling, and decreased costs. As can therefore be seen, all three major stakeholders involved in the urban logistics ecosystem are incentivized by the UDC intervention. Let us now look at the challenges of implementing an urban distribution center. There is, of course, a loss of direct contact between carriers, suppliers, transporters, and customers. The new scheme also needs to ensure that there is fairness towards all transporters and retailers during the bidding process. A more major concern is that the operation needs to be self-sustaining or would require government subsidies. While this may not be a problem in the Bronx, it may present itself as a challenge in a global developing context. The public-private partnership also requires the government to be able to implement, incentivize, or mandate favorable regulations and policies.
So given the feasibility, the pros, the cons, and the urgent need for an intervention, we believe that this is the best solution to mitigating air pollution risk around the globe. Thank you for joining us.